Okay, namaste. I'm thankful that I did not have the post-lunch session. It's one of the most difficult, and I think most of you are awake now after the lunch. I know that we had very brilliant speakers the whole morning, including Rachana, who did the presentation just now. And what I'm going to present will take your train of thoughts somewhere else, far away from mental health and holistic medicine. Well, just a bit of introduction of myself. And anyway, my slides are actually very brief because I'm cognizant of the time factor. I'm an actively practicing general practitioner in Malaysia. I'm an advocate on equity in health. And I'm the past president of Malaysian Medical Association and the current president of the Manipal Alumni Association in Malaysia. I'm a graduate of Kasturba Medical College, Manipal. So, my topic. Professional ethics in the current era of healthcare industrialization. So my objective today is just to raise the issue of professional ethics, which is in danger of erosion by the industrialization of healthcare. No one can escape industrialization, but we do worry about what implications it may bring. So industrialization of healthcare is all about improving efficiency and the lowering of costs. Everyone is talking about cost nowadays. So it's also about lowering of cost by utilizing manufacturing processes and techniques in the way delivery of healthcare is managed, thus creating a shift towards value-based care models and outcome-based reimbursement. Industrialization of healthcare has been described as having been brought in after World War II when the world was gripped in all sorts of shortages. But the current ongoing industrialization has got perhaps different goals, which is being rapidly fueled by technology. Throughout the morning, during the presentations, many have touched on new technologies coming in, AI-driven technology and all that. And in healthcare, it is the truth. This is what we are facing now. So the world is currently looking at an exponential rise in healthcare costs caused by many reasons. We are not just talking about gradual rise in healthcare costs, but an exponential rise in healthcare costs. And I think if many of the medical practitioners can take heed of what has been discussed today, mental health, and when talk about mental health, we are also talking about preventive medicine. And all those can also help to, sort of reduce the exponential rise in healthcare costs. And one of the speakers this morning mentioned that she laments the lack of referral from medical doctors to the psychologists. Actually, for me, I would say that it's not about the referral of patients to a psychologist, but rather there has to be a cognizance of the mental factor in every patient which is being seen by the medical doctor. If they can recognize that, I'm sure that a lot of wonders can be done when they manage their patients well, and we will not be facing what we have been discussing throughout the whole morning today. Well, let me get back to my presentation. So one major reason of concern is the world's aging population. Now, many countries in the world are catapulting unprecedented and unprepared to grapple with the healthcare costs of its aging population. Healthcare for the aged will increasingly eat up the health budget allocated for the general population. Healthcare for general population is already high, but when you translate that or you put that into the healthcare of the aging population, the cost will go very much higher. It takes much more to manage an elderly person as compared to a young patient. I'm sure all of you will agree with that. So not only cost, but the manpower and infrastructure needs, the manpower and infrastructure needs of the healthcare of the elderly will also have to be catered for. Then the modern population. We know that the younger generation have different expectations for healthcare. No more satisfied to what was offered a generation or two ago, the expectations of a younger generation, those at the back, the expectations too have driven up the cost of healthcare. And these are just but a couple of the many factors that is driving the industrialization of healthcare today. But what is the problem facing industrialization of healthcare? Industrialization of healthcare has led to a dehumanization of healthcare, where the traditional model of doctor-patient relationship is being challenged. I'm sure all of you would agree with me. Many have spoken on the erosion of medical or professional ethics as we embrace industrialization. I use the word professional here because I thought that the participants here would be a mix of non-medical and medical professionals. But I think most of us here are all medical professionals. Not to say medical, but all involved in healthcare. So I would use the word medical ethics as well. So like I said, the professional ethics mentioned here is not restricted to medical doctors alone, but to all involved in healthcare. Well, the professionals who had given your presentation today, the psychologists and all that, you are also involved. So all those involved in healthcare, ranging from hospitals, scientists involved in pharmaceutical research, pharmaceutical companies, pharmacists, all, just to name a few. These are the principles, the professional ethics. These are the principles that guide healthcare professionals in their interactions with patients, colleagues, with each other, and society as a whole. And this helps to ensure that the provision of healthcare is provided in a fair and compassionate manner, keeping the health and well-being of the individual patient in mind. As a whole, professional ethics and responsibility are adopted throughout the system of healthcare provision. Patients are central in this system. Throughout the whole morning, we're just talking about the patients. Of course, we're talking about self as well. So, patients are central in this system, and professional ethics are crucial to the outcome of the patient encounter. But with industrialization, various factors are introduced, which has the capability to create an erosion of professional ethics. Some have asked me, that means, are you opposed to industrialization of healthcare? No. Benefits of healthcare industrialization cannot be disputed. There is the need to progress as we now have advanced technology which enables us to have electronic medical records and also to embrace telemedicine. I do not know how many of our psychologists and even psychiatrists here, are you embracing telemedicine? Are you doing consultation over the net with your patients? But I'm sure there are shortcomings there. We introduced all this during the time of COVID, where we found that it was difficult to engage with our patients. But personally, I feel that the physical touch should be there as well. So there is the need to progress. And medical devices, along with the use of IoT or the Internet of Things and 5G technology, I think most of our phones now have got 5G in them, right? I do not know how much of 5G coverage are we going to have in the world, but well, that's what we are moving towards. So all this will improve patient outcomes, and by using technology, one can streamline the process of healthcare delivery, leading to a standardization of procedures and processes. And this efficiency will thus be improved and wastage reduced. All this with a view to reduce long-term healthcare costs. Modern technology can reduce errors, thus improving safety and also improving the quality of healthcare. And with such advancements, the need for strong professional ethics becomes paramount. The patient must not be allowed to be relegated to just numbers of patient encounters and dictated outcomes. I'm sure for many of you who practice within certain medical chain groups, hospital groups and all that, I'm sure you understand what I mean when everyone is just talking about numbers of patient encounters and dictated outcomes. Now, coming from Malaysia, I will speak to you on my experience and a point of view as a Malaysian doctor. I'm sure that many of those in the audience who may be from other countries, even though most of you are from India, you may be able to relate to my experience as well. Malaysia has a dichotomous healthcare system with a public sector and a private sector. The public sector is fully funded by the government and it takes care of everyone. And the private sector is fully funded by out-of-pocket, they'll be funded out-of-pocket payments as well as from the various insurance schemes. We do have universal healthcare in Malaysia where everyone in Malaysia is no more than 5 kilometers away from a healthcare facility. And we have received accolades from World Health Organization for having healthcare facility no more than 5 kilometers away from any individual. But the issue facing us is, what sort of healthcare, to what level of healthcare can we offer to our people within the remote healthcare facilities? Well, I've done my housemanship in India, in state of Karnataka, and I do understand part of the issues being faced by the public health service in India, but that was more than 30 years back, and I'm sure they have improved a lot from what I've spoken with my colleagues from India, but I think they still do face a lot of problems, especially in the more remote areas. So in Malaysia, management of healthcare in the private sector, and I'm sure in many hospitals in India, it is being done by what is known as third-party administrators or TPAs, whereby the patient's healthcare costs are being taken care of by insurance or by their employers' healthcare benefit schemes. So there are these companies who will come in and they'll be the go in between to manage all these things. And what we then see here is the potential of the patient's management being taken out of the hands of those who are directly involved in patient care. I'm sure that if one of the medical colleagues were to refer a patient to a psychologist, they will need an approval from these third-party administrators who will question the need of why the patient should be referred to a psychologist. They will add on to the cost. So that may be one of the factors why patients are not just referred off for their mental assessment and all that by a psychologist. Question is, why can't a doctor do it? Why should you be referring off? So this is being taken out of the hands of the medical professionals. So the way a medical doctor manages a patient, from the type of medication to be prescribed, to the investigations that are procedures that is to be done, or as to whether a patient is to be admitted to hospital, all this is being managed by others, all in the name of efficiency and containment of healthcare costs. It is all right if it is done in accordance to ethical patient care, but many a times, protocols derived in accordance to cost overrides professional judgment. And with technology comes telemedicine, which is to be embraced as it surmounts many shortcomings involved in physical medical care, which were glaring during the COVID-19 pandemic. So now we have many online platforms offering teleconsultation without the need to see a doctor physically. We have got many advertisements online saying that you can see a doctor at any time of the day, middle of the night, or and the moment you wake up, all at your convenience. And we also have platforms offering prescription medicine, all delivered to the client's homes, without the need to see a doctor, without the need to get a pharmacist consultation. You can just get your prescription and then they'll be sent to you online. And further to that, there are also online medical cheats being offered to patients without the need to be physically assessed by a doctor. We have got that. You can get your medical cert, online. Don't worry, you can just get it printed out on your computer and just give it to your employer. So the problem facing us in Malaysia is that we have got archaic medical law, our medical act, which is quite many years back, and it's taking time for them to do amendments to catch up with in the current telemedicine era. And I'm not sure about India how it is. So all these are being done for the sake of inconvenience, in utter disregard for the safety of the patient. So, for me, a very short presentation in this interest of time. I will conclude by saying that industrialization of healthcare is a progression that cannot be avoided, and though complex with many facets to it, industrialization does have its pros and cons. It has the ability to improve efficiency in healthcare delivery. It has the potential to contain costs. Well, contains costs, but to what expense? Are we to trade off the human face of healthcare and to have patient outcomes in a wholesome manner to just look at efficiency and lowering of costs? And also to reduce patients to just numbers in the equation of healthcare? Those who are in psychiatry and in psychology, I think we always talk about the patients, the patient's well-being. Well, I think you understand what I'm trying to say. So at the end of the day, a successful outcome to healthcare industrialization is to strike a balance between the anticipated benefits and the potential setbacks as we move forward. And never forget that the patient or the recipient of healthcare, the recipient means all of us. All of us actually, instead of just providing healthcare, we are also recipients of healthcare. So all of us, we are at the center, and that is what healthcare is all about. Healthcare is all about us. With that, thank you.